Hello, everyone. I'm glad to see you in this number. Today's topic is pain management, and I got this suggestion from one of the MPS patients. I need to start with a couple days before I got this suggestion. I was reading something on internet, and I found spoon theory. I mean, one of patients who suffer from arthritis, she was saying that for her, it's really hard to deal with others' questions or judges, or it was hard for her to explain everyone why she feels pain or why she is tired. And then she took one experiment with her friend. She gave her friend 12 spoons in a cafe as a metaphor for her daily energy stores, and taking one spoon back every time when she would mention an activity. She was saying, okay, I have 12 spoons, and every activity that I conduct, one spoon is left. So let's say one spoon is for getting out of bed, one spoon is for taking shower, 3 is for getting work or travel to reach her job, and until midday she would stay without spoons. And I was thinking about that experiment, how it's hard for people who deal with chronic illness or pain, how it's hard for them to first explain to someone about struggles they have, and second, to make that storage energy through whole day. So I would say that this experiment shows how people with some chronic pain can learn to manage their 12 spoons. And if you are interested more in this, I can later send you articles or some suggestion how you can better manage those 12 spoons, or how you can save some energy while you are, let's say, taking shower or preparing a meal. And I think it's really really hard experiment for people who doesn't have any chronic illness or, let's say, chronic pain. When I was preparing this webinar today, I was really surprised how there is no many articles or literature about psychological approach to pain. Usually when I would try to find something about pain management, I would find some medical articles, let's say, about different treatments or different drugs. And I realized that it's really hard for people who have chronic disease and chronic pain. It's hard for them to deal with constant pain, and at the same time not be able to or take drugs or not be able to take drugs all the time. So I was wondering how I can incorporate psychological aspects of pain, and how from psychological field we can deal with pain. So I would start with pain and its consequences. Pain is a complex stressor that presents significant challenges to most aspects of functioning. It contributes to physical, psychological, occupational, emotional, and financial cost. And it can and usually contributes development of maladaptive cognition and behavior. I found some numbers that say that a lot of people who suffer from chronic pain, they develop some psychiatric disease. For example, it's depressive disorder, anxiety disorder, and or post-traumatic stress disorder. So what is interesting about this view of pain is that when we suffer from chronic pain, we are eager to develop some maladaptive behaviors. And usually those behaviors make pain even worse and make worsen daily functioning. I found something that can help us understanding pain a bit better. And it's about central desensitization. And the basic idea of this term is that people who have constant pain have changes that occur between body and brain that actually increase pain sensitivity. For example, sometimes it can happen that even things that normally don't hurt are perceived as painful. So it seems like our body becomes so sensitive to any pain, and especially in contact with our brain, sometimes we get information that something is painful, even if that normally don't hurt. So this can mean that some people with chronic pain may actually be suffering from malfunctioning pain signals. As I said, our brain can send a signal about pain even if there is no some organic reason. So it is about what's going on with mind that matters for the pain more than what's going on in our bodies. And I think that it's also important, and it affects this, what I mentioned, how we perceived our bodies. From my experience and experience of my clients, I know that people very often speak about body like an object. We usually use words like my body is tired or my body is hurting. Rarely we say I am tired or I am hurted. Usually we see our body like something that is distinct from us. And this also has its own consequences, because if we watch body like an object, we see something that happens to us rather than me that is happening. So if I look body as an object, I cannot process that I'm the one who is, let's say, hurting my body, or I'm the one what is happening, because we usually distinct our body from I. Maybe I would suggest that maybe in the future you can try to learn how to, instead of looking to body as an object, to start looking as a part of you, as a part of your own self. Because when we see our bodies as an object, instead seeing as our being, we make ourselves less than we are. We become diminished. We diminished ourselves. And the more we have removed our identity from our body experience, the more things seems to happen to us. Then we feel like we are out of control, that we are fragmented or dissociated. So I would suggest as one experiment in the future to try to pay attention to that body is not something that sends us signals. We are the one who are sending signals to ourselves. And there are some three, let's say, an essential approach when we speak about person and about body experience. And I will teach you now about those three approaches, and maybe you will better understand how to use your body as your own self. So when we speak about approaches to body experience and the person, we have three main points. One is monism, dualism, and parallelism. And those approaches starts from our beliefs and our belief system. When we speak in monistic view, mind is nothing more than product of chemistry in our brain. So we usually have ourselves and we have body somewhere there, and we will fix our body if we start to fix our organs. And then problem can be treated by healing the specific organ. And this approach has led to the, let's say, chemotherapy approach. And I wouldn't speak more about this because it's mostly medical term. In dualism, the mind and body are separate from one another, and each of them requires special treatment. Let's say we use verbal therapy for our mental problems and physical therapy for body distress. And in this approach, body and brain, they don't influence to each other, and the solution is to treat them separately. But when we speak about parallelistic model, we have combination of body and mind. And me personally appreciate this point of view as the most, let's say, the most healing one. Because here, body and mind are separated, but they are linked together. For example, that means that they can affect to each other. Problems in one domain, let's say brain, will be a function of dysfunction in the other. So change in brain will have impact on the body. And here we have, for example, that psychological stress can be seen as affecting the body by increasing psychological arousal. Somatic problems may represent emotional conflict, and bodily distress can cause mental illness. And I think that in this, we look this parallelistic model, and if we see person as a whole, person who has body and who has brain, and that those two parts are incorporated together and that they affect each other, then we can speak about managing the pain. While I was preparing this webinar, I realized that sometimes, pain is real. It can be, and it is constant, real, especially for MPS patients. But sometimes we have those mental beliefs or attitudes that make pain even more greater. So when we speak about chronic pain, what affects to chronic pain and what makes it even more stronger or long lasting, we have two main negative psychological consequences. First is pain catastrophizing, and the second one is fear of pain. Pain catastrophizing is defined as a negative cognitive and affective mental set related to expected or actual pain experience, which means that when we feel pain is a pain that we feel in part of the body, plus we have our thoughts and beliefs that are negative and that can, and they increase pain experience. Pain catastrophizing is characterized by magnification of the negative effects of pain, rumination about pain, or feeling about pain. When we catastrophizing, we have difficult to coping with pain. We feel more helplessness, and we have more intense pain or higher level of fatigue. So that means that if we use our mental set in a negative way, if we catastrophizing and we predict how we will, let's say, oh, I will have pain until the rest of my life, it will be just greater pain, or I will have even higher level of fatigue, that will contribute to poorer pain coping and overall functioning. And I found some studies that support these theories. When we speak about pain-related fear, it usually reflects a fear of injury or worsening physical condition. So when we have fear from pain, we usually decrease, let's say, activities, and we start to behave in a passive or avoidant behavior. And the pain-related fear is associated with increased pain intensity and increased disability. So it looks paradoxal, because we have fear of pain, we stop doing anything, we stop activities, but it turns out that we have increased pain and increased disability. So when we mention those two psychological, let's say, consequences, we can speak about how we can prevent and intervene in those areas. What shows up as a way to cope with pain actually is accepting pain. Accepting pain is a process, long process that can, even when we accept pain, we have some crisis in life that triggers us to question again that accepting. But what is actually accepting when we speak about this? It's engagement in the present moment in a way that allows us to either maintain or adjust our behavior in the way that is most consistent with our values. Pain acceptance consists from non-judgmental acknowledging, also with stopping maladaptive attempts to control pain and learning to live a richer life. And accepting pain can predict lower level of pain catastrophizing and greater level of positive effect. So when we start working on accepting pain, we can work on those first views that I said, pain-related fear and pain catastrophizing. So, and how we can accept pain? Because I used psychological point of view, I will speak about therapies that can help you to accept the pain. In literature, the therapy that gives the best results is cognitive behavioral therapy. And this therapy focuses on restructuring negative cognitive schemes into a more realistic appraisal of the patient's current condition. So as we were speaking on our workshop in Verona, we need to somehow reshape our thoughts in order not to have catastrophic prediction or fear that is pain related. So when a realistic perspective regarding the past and present and future is gained, then people who dealing with pain can more easily deal with their own pain. So examining the automatic thoughts that are present in pain, the patient can start to work on those automatic thoughts in order to distract themselves of those automatic negative thoughts and to try to reframe them into something positive. For example, when pain worsen, automatic thoughts is the pain has never been as bad as this is, or I'm getting much worse. And then we can go further. I will not be able to take care of myself. I will not be able to get a job. And these thoughts often lead to more physical and psychological distress. And through this type of therapy, the most important is to help the patient to recognize when an automatic thought is generated is necessary first, and the patient needs to learn to rationally dispute those catastrophic cognitions. Because as I said, when we feel pain, our negative thoughts will make our pain even more worse. What also can be helpful is relaxation And this relaxation is often part of this cognitive behavioral therapy, and usually through progressive muscle relaxation or stretch-based relaxation, deep breathing, and autogenic training. Those relaxation techniques can be learned. Those techniques help to relieve pain and help patients to feel like they are in control over their illness or pain. When we speak about this relaxation, what is important in this is to learn about your body, to be aware from where pain is coming, or while you're breathing, you can feel how muscle, bone, whatever relaxes. And then that can give you some sense of power, which can help in a life with pain. What I would mention else as one of the techniques is mindfulness, which means to pay attention to something. And when you pay attention, that attention has its own purpose. Instead of focusing how badly we want to stop pain, or how badly we want it just to pass, instead of that, we will pay attention to our pain with curiosity and without judgment. Because when we judge pain and when we want to disappear, our brain creates frustration and feelings of being trapped or being hopeless. So mindfulness teach people with chronic pain to be curious about the intensity of their pain, or to be engaged with pain. I know that this sounds pretty scary, because when we are in pain, we just want it to pass or we want to stop it. But I really believe that if we get in contact with pain, that we can learn more and that we can give ourselves more time without pain. Because our goal is to engage with the pain just as it is. It's not about achieving a certain goal, like minimizing pain, but learning how to relate with this pain. What I use with my clients is to bring awareness in our body, to bring awareness about every part of our body. And when we get in the touch with pain, we can start asking questions. What can I learn about this pain? Or what do I notice? Also, I would suggest you to do, when you have time or when you feel overwhelmed with pain, to do body scan, like to bring awareness to your body, to make contact with those parts that are in the pain, and to make some dialogue, because our body usually knows more than our brain knows. Our body can tell us, okay, I'm tired, I was walking yesterday too much, so maybe it's time to take a rest. And of course, what I would suggest is breathing, because when we breathe, we can inhale some freshness and some support, and we can exhale some burden. What I would mention more is that every pain can have both physical and psychological components. But the psychological components of pain are usually dismissed or never acknowledged. We usually speak about pain when there is some presence of some harm, but we have example of constructor worker who came into emergency room saying that his that nail got into his boot, and it was so painful, and the patient was sedated with some drugs, but when the shoe was removed, it turned out that the nail hadn't passed between his toes. There was no injury. So pain can exist in the absence of any harm. And I'm not saying that this is the case with MPS patients. I'm just saying that both can be both physical and psychological. Pain is not just something that happens to us. We are participating with pain, but by how much attention we give to it. With our thoughts, we can participating in our pain. We start to ask ourselves how awful and negative this is, how helpless I feel about that, or am I feel like a victim, or I am at the mercy of this pain. And so that's why it's important to understand how our thoughts and how our mental psychological set can influence to a pain. What makes pain even more unbearable is the not knowing what will happen in the future. And when we start to predict future, when we start to catastrophizing our pain, it becomes even greater. And that's why I would suggest you to be aware of your body and be present in this moment. Also, what I would add, I don't know if that's your experience as well, but a lot of people who live with pain stop being active. Even though studies comparing exercise to no exercise for chronic pain are distinctly clear, physical activity can help relieve pain, while being inactive can delay a person's recovery or a person's better quality of life. So after all this, I would like to make some summary. And I would recommend to try to be in dialogue with your own body, to pay attention to your own body, to try not to dismiss or diminish pain, but to get in touch with it, because I'm sure that there is something that pain wants to say. Plus, to be aware of your automatic thoughts that shows up when pain is present. How to make our automatic thoughts that are negative, how to make them more positive or more realistic. And I think that's the main task of accepting the pain, because especially for chronic pain, it will not disappear. But the main task is how to learn with it and how to acknowledge pain as something that is present. Thank you, everyone. And now we can start with questions.